Good evening. Welcome to Between the Lines. We'll see what the day is. I got to work on it. May 11th, 2023. We're aging fast. But it's a great show tonight. We're going to talk about nursing. We're going to talk about immunizations and some of the stuff that the Department of Nursing at the University of Tennessee, Go Orange, is doing. I wore my appropriate tie for all the staff at UT. I'm just excited because I finally got a family member of one of my class at Oak Ridge. Doris and Linda Love were in my class of 1973, and this is Doris's daughter. And that's good. I like that. And she'll watch it. That'll be great. Tell us a little bit, I guess I should say who you are, shouldn't I? Danette grew up in Clinton. Tell us everything you can. Tell us what you can about yourself. So you were raised in Clinton?
Yes. So I've been there since I was in the third grade. Yeah.
Okay. And what did you do in high school that got you interested in nursing? I mean, tell us how that evolved.
So,
did Doris push you out there and say, go to school, or how'd that work?
No, actually, I didn't do great in high school, really. And I went out and worked at Pizza Hut in Clinton and got a couple of years of that and decided that was not for me. So I went back to school, and I really wanted to be a psychologist. And the professor pulled me aside and said, that's great if you want to do that, but know that you're going to have your master's degree before you make any money.
Sociology, same way.
Yeah.
I got a degree in psychology and a degree in history, and Pizza Hut was where I probably made more money.
Right.
But I did business type stuff, so it was good. It's always been beneficial.
Yeah.
I mean, I learned a lot of stuff. I went to Middle Tennessee State, played basketball for a year or two, but I really enjoyed being, nobody does it anymore, but I really enjoyed the social sciences.
Yeah, I did too. And I took a lot of those classes. And he kind of veered me towards, he said, go into psych nursing. So I started the program back in 2004, and then became pregnant for my son.
Okay.
And I decided to withdraw from the program at that time. I finished and got my general associate of science, and withdrew at that time, and homeschooled him for 8 years, and my other son.
How was the homeschooling thing?
Tough. I'm not sure I made the right decision. They tell me I didn't. They but they're teenagers, so they tell nothing I do is right. So,
yeah, teenagers never like it because it's hard socially.
Yeah,
but it works academically.
I mean, they're brilliant children,
they get that from their grandmother, by the way.
They do. They do.
She was smart. Linda was smart. Linda was more straight laced.
Right.
Your aunt, and she was just like this. Doris was more of the energetic, outgoing.
Yeah, she's more of an entertainer.
Yeah.
Social, but they're both
great
socially.
Great women.
Yeah.
My class, academically, they were strong. They were great. Yeah. But they were so friendly.
Yeah, they're wonderful.
Okay, let's.
Yeah, so
one child?
Two. I have two. One's graduating tomorrow from Clinton High School. Go
Both
Dragons.
Boys?
Both boys.
Okay.
And the other one will be a sophomore this coming year. And he's in the band in Clinton High School. So.
Why homeschool?
We tried out Lake City Elementary, where I went, and it wasn't a good fit at that time. And so decided to try homeschooling, see how it went, and we just kept going with it until.
Yeah, if you've got the time, how could that not work?
Right.
That's a good thing. I mean, if you got the time. And there are some schools that are demographically challenged. They have kids from this area, that area, this area.
Right.
It's hard to get a congruent message at works and different things. Although I love Lake City.
Yeah.
And it's still Lake City to me, of course.
Yeah, me too. I went to Lake City Elementary Medford Elementary, then Lake City Elementary, then Lake City Middle School, and Anderson County High School. So I love that community.
The building for Medford Elementary is not holding up well. Did you notice that?
I did not notice that.
I think it's kind of destroyed.
I think it's a plant now.
It was. I think when I was helping the county, had some asbestos problems or something. I can't remember.
I still have a chalkboard from a teacher's classroom and a desk from the old Medford classroom. But
So you went into nursing, you got back out because of family commitments and all that stuff. So when you went into nursing, what path did you take? I mean, did you go psychological nursing or so?
So after
what does that mean?
getting some experience, I actually wanted to go back and be a nurse midwife, and I went back several years later. I had a couple people in my family have some medical problems, and I spent about a month in ICU with them. So I saw the nurses there, and I was like, I want to go back and do this. And so I re-enrolled, and I enrolled my kids in school and went back. And midwife is what I wanted to be at that time. Then I had a rotation on the labor and delivery floor and decided no thanks. So
Okay, so you went into UT, you got a degree in nursing.
went to Roan State first. Roan State's where I got my associates. Love Roan State. I've got 2 degrees from Roan State, associate degrees.
I'm trying to convince my son, who is, he takes AP courses. And stuff. He loves them.
Yep.
Doesn't do great, does good, but not great. But he looks at them, he loves them. But when he gets out of the school, backpack never comes out. He studies hard during the day, but he doesn't like to spend time studying. His grades are good. I mean, he's 3.3, 3.4, and he's got AP class. But I'm saying to myself, look, you want to be in data, and he's real good with assessing stuff, data and stuff like that. Why not go to Pellissippi or Roan State and get the basics, save yourself 20, 30 grand,
Right.
get it all done. I'm going to Utah. I want to be Orange. You know that.
Yep.
Or Middle Tennessee.
Yeah.
Because I played there. Maybe, it's just hard to figure out where kids are going and what they're doing. When we grew up, your mother and your aunt, I mean, they had a pretty good idea, and they were both majorettes and very talented. And I didn't remember. I've been in touch with Linda off and on over the years. I didn't know where your mother was living, but very talented people like to be creative and find what they want to do. And do stuff like that. So I get that. So you get out, you do things. First nursing job.
So I got out, graduated from Roan State. First nursing job was University of Tennessee, UT Medical School. So University of Tennessee Medical Center. Let me get that right.
You got it.
Mixing them up.
Over the hill.
So I started on the GI and general surgery floor.
Okay. And how long? Just take me through it.
So I was there for about 2 years. I decided at that time I'd go back for my BSN. So I got my BSN from East Tennessee State University.
Which we equate to a 4-year nursing degree.
Correct.
Okay.
That is correct.
Okay.
So I got my Bachelor's of Science in Nursing from ETSU.
Did you have to go to Johnson City?
No, did all of it online. Because I'd already finished my clinical portion of it at Roan State. So
Did
it
you
was
have to
really,
go up and take tests in Johnson City? Okay.
Nope. It's a lot of
The
paper
world's
writing.
changed, hasn't it?
A lot of paper writing. There were some tests, and they're proctored online. And
that's
so
important.
the videos watch you. They have the sound up.
Sure.
All that kind of stuff.
Yeah, that's the best way to do it.
Yeah.
Right?
So I graduated from that. I was there at UT Medical Center for about 2 years, and COVID hit while I was there, and that was a crash course in nursing. I kind of had my feet under me by then.
And you've lived in the Anderson County area this whole time.
Lived in Anderson County
That's
the whole
amazing.
time.
That's fantastic.
Yeah.
Some people stay home, right? I mean, some people stay home. Tell me about, in the nursing programs and what you've done, what areas did you like the least and what areas did you like the most?
Oh, I do not like pharmacology. I just finished master's level pharmacology 2 days ago, and it's getting better as I keep taking it. But I loved public health. I ended up going into public health after I left UT. So I just love, preventing disease and working together with community members. So I really liked public health. I like pathophysiology. I like to find out the why and get down to the, cellular level and chemical level. And
That's a lab deal, though, isn't it? I mean, you don't do much of that out.
I don't do that, but I need to know how it affects different organs, what's going to happen with the cells. If a red blood cell is affected, then it bursts, then it affects the kidneys.
So you're taking it a little bit beyond the average nursing situation. I got that. Shortage of nurses in this country?
Oh, yeah, has been.
Okay, explain that to me. What kind of nurses? Where are we short? I'll tell you. Let me rave for 1 minute. Now, I just had knee replacement. Oak Ridge Hospital did a wonderful job. I can't say enough about Randall Robbins and the orthopedic. Did a I'm 8 weeks out. I'm walking, doing great.
Yeah.
Still got a couple days of rehab left, but I mean, it's building strength now, not flexibility, and they just done a good job. It's been very, and I give credit to their physical therapy program over there. But my last instruction to him before I went into surgery was, and I knew all the anesthesia. I just know most of them and I said was, if for any reason there's a problem and I have to stay, etc., do not put me on that elevator. You put me in an ambulance and you take me to Park West. Because the horror stories we've grown up with, and I'm going to get back to it, it's not a reflection of the staffing at Methodist, not a reflection of the management at Methodist. it's a reflection of, in my opinion, of the short staffing and you can get things done. I mean, this is not just true in medicine, but you can get things done in other areas where I've never thought Methodists got the proper respect, at least in the last 10 or 15 years. Nurses have had to go on strike, other things. And I just thought that the ratios and everything else that I've read about and talked about on the show makes Methodists a little more susceptible to me. Is that a fair statement?
I'm not sure I agree with you. Methodist is the only union hospital that we have. They, as far as I know,
who's we?
East Tennessee.
Okay.
As far as I know, they still do team nursing, so you have some LPNs there. A lot of places are making LPNs kind of get out of the workforce or go on and get their BSN, but LPNs have great knowledge of pharmacology. They just have been in it 20 years.
Working nurses, sure.
And so they run CNAs, LPNs, and RNs as a team nurse. And I did some clinicals there, and I'm not. I think I would be comfortable.
When I went to get my
Methodist.
testing, I did at Cheyenne, but I did some at the hospital. And did some things. They were just outstanding.
Yeah.
But the stories we've had about our parents and other people being
Sure.
in there, I guess maybe it's a little bit narcissistic because people die in hospitals. That's what that happens.
Right.
But he was fine, and then he died. She was fine, and she was died. Don't go to. I mean, that's kind of a widespread thing from what I hear. But it could also be because, to be fair to Methodist, they have a mission that's different than all the other hospitals. I mean, they basically serve the under-income, underprivileged rural counties above us. And that takes a lot of, they don't have the revenue
Right.
and income. So I respect them a great deal, but I just, of course, I know my doctors are from Park West and that kind of stuff. So anyway, I don't know where I'm going with that except to say nurses have a tough job.
They do, and they're underpaid, and they're understaffed, and their ratios are too high, and until they fix that, we're going to be short-staffed in
Well, they
nurses.
were really good to me. I mean, I'm really appreciative of them. And first time I'd been to the hospital since I was 12, 62 or 68 or something. But I was really appreciative of the hard work. Cheyenne's a great place.
Yeah, Cheyenne
I love
is.
them too. I mean, they process it, but so is the hospital.
Yeah.
I mean, it was different people. And my doctors kind of said, look, listen to me, and explained it all to me in that kind of sense. So, et cetera, et cetera. So you're doing the UT thing.
Yeah.
And you're getting out. Now, the last time, the newest evolution of your career is, I got it. It was to evolution. When we get back, we'll talk about what that means and how you get into immunization, vaccines, because that's important stuff. And now you're in public health.
I'm in public health.
Okay. Okay, Chandler, let's go to break, and we'll be back shortly.
Daniel Forrester has been recognized as one of East Tennessee's leading attorneys for nearly 2 decades. Civil disputes, criminal defense, divorces, and juvenile custody cases are all part of an impressive resume. Daniel's legal experience also includes representing clients in local, state, and federal courts. A husband and a father, Daniel is a Rule 31 certified mediator who has represented hundreds of families in Chancery Court. Call Daniel Forrester Law Office at 865-457-7900 for a free consultation.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
At Navarro, we partner with our clients to advance clean energy and deliver effective solutions for complex challenges in the nuclear and environmental fields.
Birchfields is Oak Ridge's premier dining spot. They offer an incredible breakfast buffet that's just $14.95, and it includes your drink. But they also offer Eggs Benedict and pound cake French toast. From 4 to 6 p.m. Monday through Saturday, Birchfields offers happy hour specials, including 50% off appetizers and special prices on drinks, plus amazing dinner entrees that are served from 5 to 10 p.m. Enjoy an unforgettable dining experience today at Birchfields, located inside the Doubletree Hotel on Illinois Avenue.
When should you get tested for COVID-19? You have symptoms of COVID-19, such as runny nose, congestion, sore throat, fever, cough, shortness of breath, muscle pain, headache, chills, or loss of taste or smell. current testing recommendations say everyone should get tested immediately if they have symptoms of COVID-19. If you have symptoms, be sure to follow recommendations about how long to stay home and away from others. For more information, visit our If You Are Sick or Test Positive webpage.
All right, crew, let's get started. All right.
Don't ignore the law. You must call 811 at least 2 to 3 days before any digging project so you can avoid hitting our essential buried utilities. For digging projects big or small, make the call to 811.
All right, we've been through one segment. Danette's put me in my place already, which is, that's probably genetic. They were smarter than me, too. Yeah, Susan and Linda. What is this new program? You talk about public health. Now you're involved in it.
Yeah.
We've talked about it, but I'm going to let you explain it. Is it a new program?
Yeah.
It's coming out of UT Nursing.
It is.
Tell us
UT
about
College
it.
of Nursing. So UT College of Nursing got a grant from Tennessee Department of Health,
Okay.
which was funded by the CDC. And the grant is to address falling routine vaccine rates. So, of course,
Falling meaning less people
Yes,
comply.
that's correct.
I'll give you
and
that
so
in a minute.
we're really focusing on the 2 and under group and the 50 and above, and those two groups get the most vaccines during those ages, and they also are most susceptible to diseases that vaccines can prevent. So that is the project in a nutshell. It'll run until this time next year. I came on with the very first group of nurses in late May.
Where were you when you came on?
I was at Knox County Health Department.
Okay, you said that, yeah. Okay,
Yeah.
you told me that off the camera, right? Okay, so I want to give you my opinion on the whole immunization drop. What the big debate we have is vaccines and immunizations the same thing? And I think that language and rhetoric has an impact on compliance or willingness to do things. The minute you call it a vaccine, we got a problem with a lot of Tennesseans. You call immunization, we all grew up with that, right? I mean, we all had the shots and the things when we were little kids and Oak Ridge and stuff. But, I mean, when you start talking about vaccines, we start going back to all of the rhetoric around COVID and all the problems. You told me here that you saw a very positive change with patients at UT when they got the vaccines, et cetera, et cetera. I had it. It was less than a cold because I had a vaccine, and I had it a couple times probably. But a lot of people got sick, my wife included. A lot of people got sick. They had feminine problems, tubal problems. Teenage boys got very sick. There's an increase in deaths among those groups. And a lot of it, and I've always explained it this way. Same with polio, same with everything. They had more time then. But see, we had to bring a vaccine fast because of the threat of the disease. So we had moderate tests, small testing groups. We really didn't have massive 5-10 year like we normally would. So you cure the 97%, or you help the 97%, knowing, not who, but knowing that 2 or 3% will probably be affected in some way because of a condition they have or whatever. And I'm not saying that the vaccine in itself causes the problem. I'm saying that certain people have underlying conditions that make it a bad application. Overall, probably a very positive thing. And COVID was kind of different. I wasn't a masked person to speak of. I complied. It made sense. But I see 4-year-olds doing this in schools and just tearing them. It made no sense to me. I think but I'm not saying it because I'm right or wrong. I'm saying it because that kind of phobia in the community on all sides makes it harder for you to go back into the community and get those rates up because they don't trust the government. That's all I'm saying.
That is one of the barriers that we're assessing.
Yeah.
Is
I'll be interested in the
distrust,
results.
is distrust, is misinformation, those kind of things, is that kind of spilling over into routine vaccines? We know that that's there for COVID vaccines. Is that affecting people who are getting their childhood immunizations? Is that affecting some of our seniors getting their pneumonia vaccines or immunizations? Same thing. And some people call them shots. Like, it depends on where you are and
That's
how
negative,
the
too.
language you grew up with.
Yeah.
I did have a guy, we were out in the community and giving COVID and flu vaccines, and
In Knox County.
in Knox County.
Okay.
And he wanted a flu vaccine and absolutely did not want a COVID vaccine. Absolutely fine. So we gave him the flu shot, and I walked over to the woman who was keeping records, and I said, he needs to wait his 15 minutes so we can monitor him after he got his flu vaccine. And I thought he was going to jump out of that chair and hit me. He said, I asked for a flu shot, not a flu vaccine. So you really have to just, sometimes it
As
pays
a
off to
lifetime
change the
marketing
language.
person, yeah, it does.
Yeah.
Shots. I mean, immunization sounds good. I mean, that's what we all grew up with,
Mm-hmm.
et cetera, et cetera. And you had your little mark on there for measles
Right,
and mumps
right.
and everything,
Mm-hmm.
and we all grew up with that. And I think it was interesting how to deal. Like, we had professional athletes gave up millions of dollars just to sit out for a year because they weren't going to get vaccinated.
Mm-hmm.
In different places. So it's kind of interesting. I mean, I get it with certain kinds of religions and people that don't, but most of the rejection was not that. It was just a distrust. And let's be fair, it's not a Democrat Republican. Trump initiated and cooperated with them, and then Biden came in and did the same thing and actually praised Trump. So it wasn't really a political thing. It's more of a big brother thing, I think. So I guess what I'm saying is that when you go out here and try to sell these and get these up, you got to differentiate that stuff, I think.
Okay.
I don't know. I mean,
that's what we're doing in part of this assessment piece is talking to community members and saying, how can we do better? How can we gain back the trust? What are the issues? What are the barriers? So language is a huge barrier. When you go from talking to folks in Oak Ridge to talking to folks in Briceville, you've got to be aware of the language and that you use. So
Would you say males are more resistant than females?
I think so.
Yeah, I do too. I'm throw that in there. Study. I just think that mothers are more involved directly, and not to say a father doesn't love his child as much, but the rhetoric, the conservative rhetoric that comes up against that sometimes, I think that's a lot of that is more male driven to me. I mean, when I was sick, I didn't care. My father was in California. I was looking for mama. No offense to my dad because I trusted him, but I mean, my mother was, that's just the way kids are. My son, now he's 17, go right by my room. He got no time to talk to me. I'm waiting till mom gets home to take my cold medicine, and rightfully so. I think that's the way we were all brought up and raised in that sense.
Yeah, I think most of those mothers at that time were making most of the medical decisions, and since moms have to kind of take care of you when you're sick, they don't want you to get sick, and vaccines are way not
and
to
they
get
tended
sick.
to be home more too in those days. In my days, they tended to be
Back
home.
in the day,
70-80% of our mothers were at home. And obviously it changed over time and stuff. But that doesn't change the effectiveness of anybody. It just means when you see somebody all the time, you develop trust patterns, I think. That's what I think.
Sure.
So tell me about the rates. What's going on with them? Let's talk about under 2 first.
Okay, so there's 2 and younger data that's out. It's called the 24-month survey. You can find that on Tennessee Department of Health website if you want to look at it yourself. And for Anderson County, when I first started this project, I had a certain set of data that we looked at. We looked at social vulnerability index, and I have 9 counties in all. I live in Anderson County, so I was kind of like, where do I start?
Let me go back because that's not my fault. There's 2 people handling this grant program in East Tennessee. You're one, and there's one more.
No, we have 15 nurses across the state
What
of
was the
Tennessee.
2 thing? You and another nurse. What were you talking?
So we have 2 in the East region.
That's what I meant.
Yes.
The East region.
The East region.
Okay.
Yep, myself and Maria.
Okay, so you and Maria are doing the East region. You have certain counties. Now tell us what those counties are.
So I have Anderson, Campbell, Claiborne, Morgan, Granger, Roane, Scott, Knox, Union. I'm not sure.
Well,
if
you
that's
pull
9.
Knox and Anderson out of there, you got some pretty rural people who might have a higher level of resistance, I think.
And then,
especially Claiborne.
Yeah, when I looked at social vulnerability index and kind of things, and then that kind of shuffled because we got new data in, and so Anderson County actually moved into one of my more vulnerable counties. So Campbell is my highest county, followed by Claiborne and Scott, Union, and then Anderson.
But isn't it interesting that Morgan
And Morgan also is up there.
is up there? I was going to
Yeah.
say, that would make
Morgan's
sense.
up there too.
All right.
And actually, Union is not up there. It's Granger that's up there. Union used to be, and they fell down.
Let's Fell down in what sense?
That they are not as vulnerable as they were when I started.
So they've
the
actually
project.
gone up in immunization. I got you.
Yeah.
So there's a vulnerability gauge and there's an immunization section.
Mm-hmm.
Okay. So what are the main immunizations? You said when we talked, you focus on 2 and under, 50 and over.
Right.
Half my friends think I belong in one population, but that's okay. That's okay. They
Yeah.
pick on me a lot. Okay. So to start with 2 and under.
Yeah.
So you got, what do you got? Measles, mumps?
You get those at 12 months. So you start out with your hepatitis B. That's usually the first dose that you get, a birth dose. And then you're going to get your polio vaccines. I think I've given you one of these as well. I have to remember all of them.
It's okay, you can read 'em
Polio
off, sure.
vaccines, your DTaP, your pneumococcal, your Hib, rotavirus.
I recommend that. I know that one.
PCV, yeah, you do the PCV 13 when they're young, and then when you get older, you'll do a 15, and then when you get above the age of 65, you'll do a PPSV 23, which is just polysaccharide. It's, yeah.
I remember my son, everybody around 7 or 8, 4th grade, 3rd grade, somewhere in there, had to get 4 shots. 4 of the ones you mentioned. But the 4th one, he said, here it comes. The 4th one was the tough one. And he was really upset. My son was really upset. It's always sad to see that kind of stuff. So you're out there trying to get people to comply with these. Under 2, how many of those were under 2 years old?
How many of these vaccines I just listed off are under 2? All of those are under 2. You get your MMR later on, not necessarily.
So those
it's a
are really-
series, though. You have for a lot of them, you have to get 3. So it seems like you're getting a lot of new shots every time, but you're not. It's a series of 3. You're getting that same one you got at 2 months. You're getting it at 4 months. You're getting it at 6 months. Now you're done until kindergarten until you get a booster, or now you're done until 7th grade until you get a booster, and then
So your job is to get them started.
My job is to see what the barriers are, and then kind of
Marking around them?
and see what I can do.
How long you been doing that?
About
Checking?
a year.
What are the barriers?
So-
far? I understand it's an incomplete study.
Yeah, I only
I do
have a
polling,
few more surveys left to get for parents.
What's your gut, though? What do you think the main barriers are?
I do look through those, and I've done a bunch of interviews. I think the barriers in
Social
some of our
political, aren't
rural areas are transportation, and that they have other
Really?
barriers that are more significant. They can't think about healthcare right now when they're struggling with housing, when they're struggling with putting food on the table, when they don't have,
Good
they
point.
can't find
So
a
it's an
used
we'll
car.
call it economic.
Yeah.
So
It's
there are
economic.
economic barriers.
And then followed closely behind it is education and misinformation. And I kind of put
Yeah,
those two together.
I think that's been true for 60 years, what you're saying.
think?
I think so. I think the people who didn't get properly immunized were people who were poor and didn't go to the doctor as much. And you don't pay attention when you're 10 or 12, but
Right.
I agree with what you're saying. In our neighborhood, we had a doctor that lived in our neighborhood up on New York Avenue. They had a doctor over here on Florida. I mean, our doctors lived among us.
And that's another thing. A lot of people grew up with someone that they trusted, so they didn't go to the internet and seek out what people are saying on Facebook. They would ask their doctor, should I get this immunization? Doctor. I mean, doctors picked up the COVID vaccine at, 99% of them got their COVID vaccine. And so the doctors are going to suggest that they get these vaccines, but they don't have a doctor that they've seen since they were small, that their parents also saw, that live in their neighborhood. So we don't have that kind of relationship anymore with our providers. And if we do, we don't have enough time to really sit down and ask them questions and talk to them.
That's an excellent point. I think, and the insurance company's timing everybody.
Yep.
You got 9 minutes. I'd switch to, and I'll give him a plug, right? Dr. Grabenstein here in town is over here, and he's on one of these mid-vit practices. Now, I have to pay $1,600 or whatever the number is, $1,800 a year to be on the program, but he's only got 250 patients. So when I go in, I spend an hour, he talks to me,
Yeah.
he builds things up, et cetera. So I think that's a great way to do things.
Yeah.
I mean, obviously, it costs
I think
money.
it is, yeah.
Costs money, but, you could help each other and get in there. But I think the insurance thing, timing people and restricting, that's just,
Yeah.
I told you off the camera, I got a lot of issues with that kind of stuff. Let's go back. You ready, Chandler? We'll be back.
Daniel Forrester has been recognized as one of East Tennessee's leading attorneys for nearly 2 decades. Civil disputes, criminal defense, divorces, and juvenile custody cases are all part of an impressive resume. Daniel's legal experience also includes representing clients in local, state, and federal courts. A husband and a father, Daniel is a Rule 31 certified mediator who has represented hundreds of families in Chancery Court. Call Daniel Forrester Law Office at 865-457-7900 for a free consultation.
We should never lose sight of our health. To keep moving forward, let's not forget everything we've learned. Limit the salty food options. Make your own daily exercise routine. And always receive regular checkups. More than anything, we have learned how important these small steps can make a big difference, so we can all continue to move forward together.
All right, crew, let's get started. All right.
Don't ignore the law. You must call 811 at least 2 to 3 days before any digging project so you can avoid hitting our essential buried utilities. For digging projects big or small, make the call to 811.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
At Navarro, we partner with our clients to advance clean energy and deliver effective solutions for complex challenges in the nuclear and environmental fields.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Birchfields is Oak Ridge's premier dining spot. They offer an incredible breakfast buffet that's just $14.95, and it includes your drink. But they also offer Eggs Benedict and pound cake French toast. From 4 to 6 p.m. Monday through Saturday, Birchfields offers happy hour specials, including 50% off appetizers and special prices on drinks, plus amazing dinner entrees that are served from 5 to 10 p.m. Enjoy an unforgettable dining experience today at Birchfields, located inside the Doubletree Hotel on Illinois Avenue.
We're learning a lot. And we appreciate Dan being here. And we're going to talk now about this survey. They're trying to establish why the rates for people willing to go to immunization, get their shots for their children, is down a little bit over the last few years. And they've come up with some, and I'm in the business, surveying, and come in with some very objective surveys that I think are very well designed, just looking over it. You give them options like, my child was sick, I didn't have a ride, not a problem, that kind of thing. So you kind of get a feel for where people socially are having to adjust.
Yeah.
The question's like, I didn't know when my child needed to get his or her shots. I believe that. That's education.
For some of them, yeah. For sometimes it's, scheduling. Sometimes it's the fault of the practice. Now they send out text messages. I get text messages. You have an appointment tomorrow, and that's very helpful.
I'm glad
for me
I
to
got
remember.
that. That's a senior blessing.
That's a blessing, and I know it has to be a blessing for busy parents with little kids.
And you have to acknowledge them. You have to go back and say, confirm.
Yep.
Or they'll cut you off the list, right? The clinical wait was too long. Yeah. I didn't have someone to take care of my other children. That's probably true. My child was sick. Well, that helps you because then you go, child care could be a big help.
Right.
Or this could be a big help. So you get some feedback. The key, though, is your survey broad enough to be at. You know what I'm saying? If I call 100 people and say, you're voting for this guy or that guy, it's not a big enough sample to help me.
No.
The sample's got to be up there a little bit. So if you're polling rural counties around here, not necessarily Knox and Anderson, but there's rural people here too. I mean, you've got to have several hundred of these to have any kind of. How many have you done?
For adults, I've got about 240.
Okay.
And I focus in my rural areas, so I've got quite a bit from Briceville area. I've got some from Oliver Springs. I've got some from Rocky Top, Lake City, Clinton, I've got some from Oak Ridge, but I'm really focusing in on areas that I feel like their voice hasn't been heard when we look at barriers. So, and my focus is rural areas. In Oak
That's
Ridge,
what
it's
it is.
easy to get around, you know?
Statistically, I'm going to say, how many possible people would you treat? What is our universe? Maybe 5,000, or how many kids would be impacted by this? How many families, that kind of thing?
I'm not sure.
Well, that's why the 240 sample becomes important. If you're dealing with a diverse rural culture where you're dealing with in these 7 or 8 counties, you're dealing with 8 or 9,000 impacted families on the low rate, then your number's got to kind of get up to 500 or 450.
Right.
If that number's 3,500, 6,500, you might be good at 300, 250, 300. So, obviously, here's how it works. If you get number 2, 3 times more than number 3, that's a good sign number 2 is valid. But when you're going 14, 16, 12, 21, 20, it gets hard. Unless those survey questions are overlapping. Like you could have some that are education, some, so you would assess it with, and that's a decent document, when you assess it with general categories and then with specific reasons. I don't know.
And we don't just use this for our assessment piece. So this is one piece of our assessment. The other is interviews. So I do lots of interviews, focus groups. So I've interviewed probably about 20 people around Anderson County, and so these are people who work in government, religious institutions, schools, counselors, mental health, who work in healthcare places. And so I take about 20 of those. I see what the barriers they say.
Okay.
And then I'll specifically, if I go
Focus
to like an
groups are good,
event,
yeah.
I'll look at it as before I send it into our own, we have SWARP's team who actually does a lot of our surveying and data collection. But I'll flip through them. That way I know at this particular spot, education is a problem. Because like, you can't even broaden that to say all of this town has this problem. The way people don't tell a story unless it's good. It's not exciting. So when it comes to vaccines, a lot of times they'll make really exciting stories because it's exciting. So it kind of gets blown up over time. That one story can affect 20 people in that one place that you're at. So sometimes you have to put all the pieces together. So talking to people, just talking to parents sometimes, looking at the surveys, the interviews that you do, and kind of pulling that all together.
Let's talk about what we're talking about, free medical clinic, who we're both big fans of. They go out with mobile units. They do different things.
Yep.
There's people exposed. I think that's kind of getting the word out kind of thing. You know what I mean? We're getting the word out. We're going to Roane County here. We're going here more and more, going to Bryceville.
Yeah.
That creates more accessibility. The question is, the assessment is, and it's a second stage assessment, is it making a difference? Like, is there changes in the numbers in there as they go, and would they give any of those things? Would they give?
Vaccines?
Yeah.
We're working together to, they already have some vaccines, and so we're kind of working together to see what other vaccines might be a good idea for them to carry. They'll figure that out, and then I'll help in whatever way they may need. But they do a lot. They already carry hepatitis B, hepatitis A. They carry the flu vaccine, COVID booster, the Tdap vaccine. They have their hepatitis C program. So, and they pair that with the hepatitis A and B vaccine. So, yeah, they're definitely making a difference
This
in
is another
vaccines and
survey.
otherwise.
And this
That
is-
is our adult. Let me back up and tell you that our pediatric survey is for parents is my favorite survey. It was created by Dr. Niederhauser, who's the dean of nursing at College of Nursing, and she used that when she did a program in Hawaii to assess barriers there. And I love this survey. You have the adult survey over there.
I like it too, though, from an objective viewpoint. I think it's a lot of information, which makes it harder
is.
to collect it and assess
It's
it.
long, too.
Always get your most important things in the first 10 lines. But, I mean, vaccines can cause long-term health issues. You're defining, kind of a perspective of where everybody's at. If you get a lot of that, I wouldn't know where to go to get a vaccine. I would just figure it out. I would go to my doctor and say, where do you go? But I don't think of, here's your vaccine store. I mean, you don't think those terms,
yeah.
right?
And you can't get every vaccine at every place. Like not every Walgreens carries every vaccine. They don't serve every age either. So in the small children, they don't necessarily do pediatric vaccines.
I
the baby
constantly
vaccines.
complain about these things,
Yeah.
education, everything else. And we've had a situation in Anderson County where everybody's worried about what's in the library, right?
Right.
And I'm thinking, push one button, it's 10 times worse, right?
Right.
But, and our libraries do a great job. What I would say this is a blessing to what you're trying to do, that here we can get information to people easier.
Yeah.
Because people have cell phones.
So we have it's kind of like a sister project that is also working with cell phones so that you can just put in where you are and what vaccine you need, and it'll tell you the closest place that has it.
That's great.
So that's a sister project under the same grant that we're on.
If you get them to push them.
It's called Smart Shots.
Smart Shots.
Smart Shots. It's in progress right now.
Tell me what the consequences for children, measurable consequences, statistical consequences are. And this is very important for parents that are listening, or grandparents. If you don't get any shots, what's the problem?
I mean, the problem is you risk disease, infection, death. You are risking your community.
But do we have those diseases? I'm playing the other side for a
Right.
second. The diseases and all of this stuff, are they that widespread that you can still catch them?
Well, they had an outbreak in Ohio of measles, and that was among unvaccinated community group. There's been outbreaks in New York. We haven't had a natural polio case, in 30 years plus, but other countries are still dealing with polio. That doesn't mean that it can't come back.
And just like AIDS, they can get on a plane and bring it to us.
It's true.
Is it contagious at all?
Polio? Yes.
Okay. It's a virus.
Measles, yeah. Measles are.
But I think, I would guess without looking at your stats, that measles would be your most compliant area. It has a high profile. Everybody knows the measles shots when they were kids. I would think that more people would be willing to take vaccinations for measles.
You know, a lot of people are more resistant to measles because there was kind of some bad news back when all that misinformation about it being linked with autism, and that has been discounted over and over and over again. And measles, the MMR, it comes measles, mumps, and rubella. It is a live vaccine, so there are like more precautions when you use that. You don't want to have that vaccine then be around anybody who is immune compromised because it is a live vaccine. In theory, they can
fly off your system into theirs.
Yeah, so I think they'll do everything except for MMR sometimes.
Is what you're doing and what the UT is doing with this immunization, and you're just doing a measurement evaluation right now. In other words, to clarify that, they're going to go out and find out why 91% instead of 98% are compliant. They got to get that data back so the UT and all of us can do a better job of communicating those messages. Is it new? I mean, have people been doing this for 20 years, or do you feel like you guys are approaching the problem uniquely for the first time?
I think we're approaching it uniquely because we're kind of, of course, this problem has evolved in other places. I think our project is unique in that we are going ahead and doing interventions. So when we see that there's a problem, we'll go ahead and offer that education, or we'll go ahead and connect this community.
On a one-on-one? Or on a group?
Everything. We do one-on-one, we do group. I did 385 fifth graders, did some education this morning in Campbell County. So I talked to parents. I was at Ridgeview and talked to them. But it might be connecting places like, free clinics to vaccine resources where they can get vaccines. It might be connecting someone with a refrigerator so they can start having vaccines. It might be teaching people how to get into a 317 program, which is free vaccines for adults, or a VFC program, which is the Vaccines for Children program. Whatever it might be, we are allowed to kind of work with our community partners and figure out how to best make that barrier less for folks.
One of my favorite stories, I believe I heard it on Paul Harvey, which was when they discovered penicillin and the mush, how it worked. And they basically during World War II or mid to early late 30s, they developed an antibody. We had antibody. We learned how to treat infection, right? So we had penicillin and other things, derivatives of that. And there's a great story about it on the bay in England. Two young men at high school age were swimming, I think it was the story, and Churchill was one of them. He jumps in, saves this kid. They come back out. They're both 17 on family summer vacation or something. It turned out to be Fleming. It turned out to be the guy. So he turned around and saved his life
Oh, wow.
20 years later. There were some great stories
That's a good
like that.
story.
Yeah, it is. There was a lot. You never know who you're going to touch in those things. You take these activity books, these are for children to learn more. What grade do you apply these to?
I just give those away.
you do
So
it
like
in
we
Campbell
did. No, I did it today I went from Campbell County to the Anderson County School Resource Fair. That was Clinton City Schools and Anderson County Schools.
Yeah,
So
so we're going to talk about your initiatives here in this last segment. Let's take one more break, run it through it, Chandler, get it done. We're having a great time. We're learning a lot, actually. Thank you. I am.
Daniel Forrester has been recognized as one of East Tennessee's leading attorneys for nearly 2 decades. Civil disputes, criminal defense, divorces, and juvenile custody cases are all part of an impressive resume. Daniel's legal experience also includes representing clients in local, state, and federal courts. A husband and a father, Daniel is a Rule 31 certified mediator who has represented hundreds of families in Chancery Court. Call Daniel Forrester Law Office at 865-457-7900 for a free consultation.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
At Navarro, we partner with our clients to advance clean energy and deliver effective solutions for complex challenges in the nuclear and environmental fields.
Birchfield's is Oak Ridge's premier dining spot. They offer an incredible breakfast buffet that's just $14.95, and it includes your drink. But they also offer Eggs Benedict and pound cake French toast. From 4 to 6 p.m. Monday through Saturday, Birchfield's offers happy hour specials, including 50% off appetizers and special prices on drinks, plus amazing dinner entrees that are served from 5 to 10 p.m. Enjoy an unforgettable dining experience today at Birchfield's, located inside the Doubletree Hotel on Illinois Avenue.
When should you get tested for COVID-19? You have symptoms of COVID-19, such as runny nose, congestion, sore throat, fever, cough, shortness of breath, muscle pain, headache, chills, or loss of taste or smell. Current testing recommendations say everyone should get tested immediately if they have symptoms of COVID-19. If you have symptoms, be sure to follow recommendations about how long to stay home and away from others. For more information, visit our If You Are Sick or Test Positive webpage.
All right, crew, let's get started. Sure.
Don't ignore the law. You must call 811 at least 2 to 3 days before any digging project so you can avoid hitting our essential buried utilities. For digging projects big or small, make the call to 811.
Okay, we're still talking. Danette's educating us. It's going well. We're learning why people need immunizations, why there's less taking them, and the benefits of all of them. I was just going over it. There's so many on here, and I don't take any, to be honest with you. I took them all as a child, but I was just telling her when her mother and her aunt were in college and I was in college, 77, I believe, we had the first flu shot, and a lot of people got sick. A lot of people got sick, had reactions to it. So all of us in college said, we ain't never taking that again. I stuck with that forever. But I'm very careful. I try to be careful, but that's kind of ignorance on my part. But that's kind of what you get into, is that people have bad experiences. And
I'll have to have you take my survey.
I'll take your survey. It's in English. That's a good start.
I've got it in Spanish, too.
I could probably get through it, but it's interesting. So you got vaccines broken into 19 to 49, 50 to 64, and 65 and over.
That's right.
And so I follow the columns down? Mm-hmm. Okay, so we don't have to worry about that. 1 dose, they got a flu shot on her, of course, and some other stuff. 2 doses of whatever, the shingles shot.
Yep.
And we were talking about that. I've never had one. Some of my friends have. But I'll tell you, Walgreens and CVS, they all advertise that stuff heavily.
You know, at the first, this part of the education, this is a piece of kind of awareness and education, just starting with the Inflation Reduction Act that passed, it became active January 1st. It used to be about $180 for a shingles vaccine.
What?
Now Medicare Part D, Medicare Advantage plans, now they cover it at zero cost. So there are a lot of seniors out there who are on fixed income who wanted to get that shingles vaccine, the pneumonia vaccine, but now that if they have Medicare Part D and Medicare Advantage, they can go and get that for free.
I am not big on restricting people getting their health care because they don't have the money, but that's another story. But that's great. That's good news. That's outstanding. If you want it, you ought to be able to get it, right? Some way. Somehow, some way. Tell us about your new, we were going to save it to the end. Tell me about what you're doing on these fairs and the big event you got coming up.
Yeah, so on the intervention, going ahead and starting some interventions in Anderson County, and what we found in Rocky Top and Bryceville and kind of that part of Campbell County that borders on that part of Anderson is that, you know, access, there's not a whole lot there. Transportation is difficult. And so I'm throwing a Rocky Top Health Expo and Resource Fair on June 5th from 10 to 2. And we've got about 30 vendors that are coming out, and we hope to be able to have some food giveaways. We do have door prizes.
Where in Rocky Top will that be?
At the community center.
So it'll be downtown at the community center?
Yep.
Okay.
And so we think that'll be easier to access. You know, Anderson County does have some great resources, but a lot of them are housed here in Oak Ridge. And so it's difficult to get to. So that seemed like a central place. The folks at the community center were great.
And there's a great need in that district. Bryceville, New River, all those things are very, they have a lot of health needs, and they don't have easy access.
Free medical clinics in Bryceville once a week, and that's great. That's huge.
Oh, yeah.
Yeah.
They're doing so much work. I hope everybody will think about that and try to make a contribution to the free medical clinic when you have time. When is their big summer? Is it August? I think they have that thing in August every year. Billy and them. That big, at St. Mary's, they have that big fundraiser.
I'm not sure. I didn't know about that. The dance?
I guess it
There's a
could be
big picture up in the, yeah.
I guess that's because I'm not much of a dancer. That's probably why I didn't remember.
No.
I'm the old chick. I mean, that's where I'm at. Obviously, with these legs, I mean, with this knee problem. But tell me, I still don't have a grasp on the numbers. I know there's, say, 10,000 children, young children, in the Anderson County, for instance.
Yeah.
And I would guess that most of them are immunized.
Most of them are. So you want to have a 95 or better. So when we look at Anderson County schools and we're looking at kindergarten data, Anderson County schools, so the county schools, are above that. They're at 97. We look at Clinton City schools. Clinton City schools have fallen down below. They're around 93. And it doesn't sound like a huge drop from 95
well,
to 93.
you got more potential exposure.
Well, you absolutely. And also, you can't, sometimes in healthcare, we're behind the ball. Like, we're constantly trying to chase down and just get things under control. So you want to get those under control now. We're seeing more religious exemptions in some of the schools. And I don't know what those are, but, you know, we want to talk about those. I know 10, 15 years ago, if you wanted to do a religious exemption, that you would have to speak to someone who was a healthcare professional, and then they would sign it, and then you would sign it. You were aware of what you are doing at risk.
Makes
Not
sense.
now. Now you can just write a note and just say, I have a religious exemption, send that to school. So that's where we are. We have daycare data. Now, daycare data is our 3-year-old data. And so for our 3-year-old data, we do see that slipping. So it was at 45. Now, I know that number sounds alarming, but the only folks who have to report to the Tennessee state system are people who get federally funded vaccines. So really, if we could get more providers on board, we can get a better picture. So like private ones, some private ones do, some private ones don't. But what we see is numbers are down. So they're going down instead of up. You would think with more providers logging onto the system, they would go up. So they're down from 45.5 to 40.7. And
What is like a Claiborne County? 81, 79? What's a low county?
A low county, like one of our very low counties would be like in the low 80s.
Yeah, that's what I figured.
Yeah.
Because you still got compliance on both sides. That's a large, 1 out of 5 is a large piece when you're looking for certain kinds of things. Tell me about the fair you're having at Lake City, the health fair. What time does it start?
Starts at 10
to 2. Okay.
10 to 2.
Get there. And what kind of things are you going to feed them?
I'm working on it right now.
Okay, so you get some food there. You don't know we're about leaving. Lake City has limited access when it comes to food.
I'm really trying to get some food. We're hoping to have Second Harvest join on with us, so we're in talks with them right now about maybe having them out there, and we're trying to get some donations of some hot dogs and get my boss to grill them. Well, our project manager to grill them.
We'll get you some donations. That's not going to be a problem. Tell me about, you know Melissa Miller at the Family Justice Center?
Love Melissa.
Love Melissa, me too.
Family Justice Center is going to be there. ADFAC is going to be there. Oh my gosh.
Great leaders all the way across.
Yeah,
They've all been on the show, all of them. That's great.
Yep, they're all going to be there. Free Medical Clinic is going to be there with their new mobile unit. So come and look at that.
Great.
Come and make an appointment to get in there and get some health care if you need to. We've got some pharmacies that are going to come out, and we've got Tennessee Department of Health is going to come out and give adult vaccines. So they're going to have flu, monkeypox, and COVID for those who qualify. We've got Be a Health Hero who's going to give those back-to-school vaccines, so those pediatric vaccines. Pediatric vaccines are free. Those adult vaccines are free. If you have insurance, they'll file it. But if not, if you're a child, you're going to get free vaccines anyway. So both of those groups are going to be there. You can get those vaccines done.
What an incredible group of nonprofit leaders in those groups, too.
We've got some great partners. I mean, really,
That's
Anderson
what Melissa
County's
calls
lucky.
them, too. Let me get one of my partners on the phone.
Yeah.
So, I mean, that's great that we can do that kind of stuff. That's important. So tell me about staffing and how you operate. You work out of home, and you go to UT, you file stuff electronically?
No, our nurse practitioner, Elizabeth Sow, she works there with Ben at UT.
Okay.
Yes, at UT. And Dr. Niederhauser and Nan Gaylord, they're all there on our team. And then there's 15 nurses across the state. We work in the communities that we live and we're familiar with.
Absolutely.
And then I spend the majority of my time out in my counties because it's, sometimes an hour and a half drive.
Yeah, you
but
have a
I'm
great
bouncing
reputation,
around
that's a lot of
all
counties
different
to cover.
places. It is, but beautiful counties. So, then I do document at home, if I'm making phone calls, that kind of thing. I do that at home, but I spend the majority of my time out in my counties.
Do you find most of the public health nurses that do the kind of work you're doing enjoy it a lot? I mean, that they're really called to that kind of stuff?
There are not a lot of nurses, so that's another unique thing about our program is it's RNs that are out there, registered nurses. We have a really good reputation with a lot of our community members, and so we're using nurses this time rather than some of the other professions they've used. But everybody loves it.
Biggest challenge to the program?
Oh, the grant. It doesn't cover food. And food brings people together, and food lets us, and sometimes we're just restricted on what the grant allows us to do. But other than that, I just have found if I don't know a person who can get me into a place, then someone else I know knows me.
That's the great part about networking, isn't it?
Yeah.
Exactly. How many people will come to a fair like that? I know it's new, but how many do you think?
I mean, I am expecting to have 200. I would like to have 200.
Okay.
I would love everybody to come out.
We're going to talk about, remind me, when is it, June 5th?
June 5th.
Okay, I got a lot of stuff going on then. Okay, so I will get it out somewhere.
Great.
Has the Courier covered it? That's what you need?
Not yet. I'm going to get on WYSH, put that out there.
Yeah, that'd be great.
Yeah.
That'd be great. I'm going to give you a number before you leave, too.
Great.
And
thank you.
we'll send you money for the hot dogs.
Cool.
I'll give you some hot dogs.
Thank you.
Or
So we'll have hot
baked
dogs then.
beans. Put the baked beans there, too.
Great.
Put it done. We'll get you what you need. I appreciate you. What kind of time I got left, Jennifer? She's done such a good job. 1:20. Minute 20. I know you got something we haven't covered in minute 20. I'm just really impressed with all this because it's an organized effort to do the right thing.
Yeah, and when we first started this, we didn't know what it was going to look like. And so 3 of us nurses got together with people who had already been kind of our leaders of the team, and we got to kind of just be like, what do we want this to look at? And so it's nurse-driven, and that's what I really like about it. A lot of times in medical, when you're working in a hospital, you're always told no. Like, I need this for my patient. I need to do this. And this has been the first job where I've been in there like, yes, let's make it happen.
I just want to reemphasize how important data is in research. This is excellent. There's an old saying, you go out and tell people what they need to know. But if you assess and you listen to them, then you come back, you got more credibility.
Right.
And they understand that you took time to ask them. And that's what it is. All right, I'm going back to Doris and Linda the last 30 seconds.
Okay.
Doris, she did a good job. She's smart. She's great, and I really appreciate her work in the community. 73 reunion, October, first weekend, ladies. Let us know. Get out here. The Love Girls, right? They were great. I appreciate you watching. This is very important. Do what you can to help.